Question number 9. What is the most likely diagnosis? And our answer choices are all ortho conditions: JIA, septic arthritis, transient synovitis, leg calvé-Perthes, reactive arthritis. So we know this is an ortho question going into it. That definitely helps us keep things at the top of our brain. They're supposed to be there and not think this is a GI question when it's a psych question. Okay, so definitely an ortho question. Go ahead and read the stem here. A 6-year-old boy presents with left hip pain for 2 days. His parents say he had a cold last week but seemed to be recovering. Now walks with a limp, is playful and alert. There's mild pain and passive internal rotation of the hip, afebrile, eating normally, and then they give us his labs. So just from that stem, there's a lot of really important things there because hip pathology is very heavily tested, especially pediatric hip pathology, because there are a few conditions that all look very similar unless you know what you're looking for. So things that are really important would be the age. In peds, age is key. So we have a 6-year-old. His parents say he had a cold last week. Believe it or not, that is probably important here. Now he's walking with a limp, but he's playful and alert, and that's important as well. Mild pain with the passive internal rotation of the hip. That one really doesn't matter too much. He's afebrile, eating normally. So our options here: juvenile idiopathic arthritis, septic arthritis, just all a bunch of different hip pathology. Let's try to think about this as logically as possible. Let's say we have absolutely no idea what it is. Let's try and use some logic here. Perhaps we'll start with the most obvious one: septic arthritis. Do you think someone who has septic arthritis, an infected joint, is going to have a normal temperature, a normal white cell count, and normal ESR and CRP? Please make sure you're at least familiar with these types of labs. ESR and CRP are your inflammatory markers. If these are high, there's inflammation. That could be infection. It could be autoimmune. It's not very specific. So we use the whole picture here. Our afebrile plus normal white count plus normal inflammation labs, probably not infection. It's also generally extremely painful, but he's able to walk, albeit with a limp. He's still walking. So it's probably not septic arthritis. Next up, I think it's probably pretty obvious, is reactive arthritis. If you know anything about that, that's the one that comes up with like chlamydia, gonorrhea. Like in a 6-year-old, probably not. And Biomi's not doing us dirty like that. And then what about some of these big names here? JIA, juvenile idiopathic arthritis. Right? I hope at least the first thing that comes to mind is this is an autoimmune condition. Autoimmune arthropathies. Do you know any others? Like if you don't know anything about JIA, do you know any other autoimmune arthropathies? What about rheumatoid arthritis? Does that only affect the hip, right? Does that only affect one joint? No. RA is a systemic illness. It can show up in the lungs. So take that same thought process and apply it to other autoimmune conditions. Autoimmunity tends to be multi-system. This guy or this kid only has hip pain, so it's probably not that. Then we've got transient synovitis and leg calvé-Perthes. I have no idea what transient synovitis is, so let's just skip it. Leg calf, I'm probably butchering that. I have no idea. LCP disease. This is an interesting one. You've probably seen this all the time compared with SCFEs, the slip capital femoral epiphysis. LCP is essentially avascular necrosis of the hip joint. And this kid's about the right age for that, so it's possible. But the fact that he's still like playful, alert, just a limp, and the fact that this has been going on for 2 days is, I think, really important, the 2 days part in particular. LCP is going to happen over time. This is when the femoral head dies, and it takes a while for that avascular necrosis to happen, for the femoral head to literally just start crumbling under the weight of the patient. So LCP is not going to happen in 2 days. So transient synovitis, it's essentially when the synovium that's surrounding the joint capsule, the synovium is part of the joint capsule, surrounds the joint, becomes inflamed. And it tends to do that with colds. So just viral infections can cause transient synovitis in kids, and it'll go away on its own. You usually can tell that's transient synovitis because, again, there's like no inflammatory markers, there's no white count, the temp is fine, and it usually happens after a cold. So the correct answer choice is C.